Dengue cases triple in Mumbai, says a leading daily. Another headline reads, over 1,000 down with dengue in Bengal. So what is dengue? Why is it such a dreaded disease? Let's try and understand a few basics and spread the awareness. Characterized by severe flu-like symptoms, dengue affects infants, children and adults alike and could be fatal. The clinical manifestations of dengue vary with the age of the patient. A person suffering from high fever in the range of 40 degrees Celsius or 104 degrees Fahrenheit, accompanied by any two of the following symptoms, could be suffering from dengue. Severe headache, pain behind the eyes, nausea, vomiting, swollen glands, muscle and joint pains, rash. Symptoms usually last for 2 to 7 days. Dengue could progress to severe dengue, a potentially fatal complication, causing leaking of plasma, fluid accumulation, respiratory distress, severe bleeding and organ impairment. The warning signs to look out for occur 3 to 7 days after the first symptoms along with a decrease in temperatures. They are severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, blood in vomit, fatigue, restlessness. The next 24 to 48 hours of the critical stage can be lethal. Proper medical care is needed to avoid complications and risk of death. Once you see any of the above symptoms, do visit a doctor as soon as possible. The diagnosis of dengue fever is usually made when a patient exhibits the typical clinical symptoms. Usually, if a patient is from an area that has a huge population of mosquitoes, dengue can be suspected. A blood test to diagnose people with dengue fever, called the DENV, may also be used. If untreated, the most serious complication is dengue hemorrhagic fever, or the DHF, in which blood vessels start to leak and cause bleeding from the nose, mouth and gums. Untreated DHF can lead to dengue shock syndrome, known as DSS, which is lethal in 90% of cases unless promptly and correctly treated, in which case fatality rates can fall as low as 1% depending on quality of treatment. Recently, there have been news stories on a dengue strain that affects the liver. This condition is also called dengue hepatitis. It leads to severe organ malfunction and in some cases even organ failure. In the cases of dengue hepatitis, fever lasts longer, often for more than a week, and leaves the patient extremely exhausted. An indication of this condition, according to experts, is the sudden rise in SGOT and SGPT levels, sometimes almost 20 times higher than the normal levels. Dengue hepatitis is characterized by high fever, lasting more than a week, extreme weakness. The blood tests show an increase in SGPT and SGOT levels, a drop in platelet count and WBCs. Because dengue fever is a viral infection, there is no specific treatment for the condition. The patient should seek medical advice and drink plenty of fluids. Symptomatic relief can be sought using NSAIDs, that is, non-steroidal anti-inflammatory drugs such as paracetamol. But drugs such as aspirin or ibuprofen should not be taken since they can increase the risk of bleeding. For severe dengue, medical care by experienced physicians can frequently save lives. It is important to maintain the fluid volume of the patient for recuperation of the patient. Dengue is a communicable disease spread by mosquitoes from one human to another. So the only way it can really be prevented is by avoiding mosquito bites. One can make sure that all egg-laying habitats of mosquitoes, like open and stagnant water sources, are cleaned up. If there are any open water sources you cannot eliminate, cover them and apply appropriate insecticides. Use protection such as window screens, long-sleeve clothes, insecticide-treated materials, coils and vaporizers.